Welcome back guys. Now let's continue with the GI secretion, gastrointestinal secretions. First of all, how much amount of fluid we are secreting into the GIT? See, we all know there are different types of GIT secretions like from the mouth, saliva, gastric acid, pancreatic juices, intestinal juices, bile, mucus, different secretions are happening into our GIT. Altogether, how many liters do you think we are secreting into the GIT? Almost 9 liters of secretions are happening, out of which 8.8 liters is getting reabsorbed back. Okay, 9 liters of secretions happening, and out of that almost 8.8 liters is reabsorbing back into the body. So we are only losing 200 ml. Here you can see these are all the different types of GIT secretions. Okay, pancreatic enzymes, bile, intestinal enzymes, saliva, gastric acid, all this. Now my question is, most of the water is getting reabsorbed in which part of the GIT? See, different fluids are getting secreted and you are reabsorbing them, right? So most of the water is absorbed in which part of your GIT? Is it stomach, intestines? If it is intestines, duodenum, jejunum, ileum, ascending colon, descending colon, rectum, sigmoid colon, in which part of the GIT maximum water is getting reabsorbed? So here is a question, very famous question. Maximum water reabsorption occurs in which part of the GIT? The answer is jejunum. So most of the students think it is colon. No, it is the jejunum. So the most important site for the water absorption is jejunum. Okay, without any doubt. Next, what is the maximum secretion? Out of all the secretions, who is more in quantity? The answer is acid. Okay, or you can say gastric secretion. Individually, gastric secretions are more. And what is the most acidic secretion out of all this? The most acidic secretion, again, HCl. pH will be somewhere around 1.5. Okay, very low pH means highly acidic. Next, then what is the most basic secretion? Out of all the secretions in the GIT, the most basic secretion, the best answer will be Brunner gland secretions. Brunner gland secretions. So these Brunner gland secretions are most basic. If you don't see Brunner gland secretions, then the next best answer is pancreatic secretions. Pancreatic secretions. Students, now you will have a doubt. Sir, what exactly are these Brunner gland secretions? We know pancreatic secretions. Okay, pancreatic juices we know. Then what exactly is this Brunner gland, sir? And why those secretions are highly basic in nature? Let me tell you. First of all, these Brunner glands are mucus producing glands. What do they secrete? Mucus. Mucus producing glands. Where? In duodenal region. So they are the mucus producing glands in the duodenum. Now, what is the importance of having this mucus secreting glands in the duodenum? Let me tell you. Guys, try to understand. Let's say here is the stomach with the duodenum. Stomach, it is continuing as duodenum. Now, see, whenever there is acid production in the stomach, that's okay, fine, no problem. This acid is going to help in the digestion. There is no problem for the stomach because stomach is having a proper mucus lining. Stomach is having a proper mucus secretion. So there is no problem for the stomach because enough amount of mucus is there. The acid can't do anything to the stomach. But whenever this acid is coming into the duodenum, okay, whenever acid comes into the duodenum, there is a pretty good chance this acid can cause the damage to the duodenum and can lead to the duodenal ulcers. Okay, so duodenum has its own protection. Duodenum has these Brunner glands. So what are these glands, guys? These are Brunner glands. And what these Brunner glands secrete? These Brunner glands also secrete mucus. Okay, they are also secreting mucus, but they are not just secreting the mucus. This mucus is highly rich in. The mucus is highly rich in what? Bicarbonate. Bicarbonate rich mucus. Why the bicarbonates are getting secreted here? These bicarbonates will come and neutralize the bicarbonates will neutralize the acid. The bicarbonate is going to neutralize this acid. So duodenum has its own protection. The mucus production is there, and this mucus is highly rich in bicarbonates. You know now what are Brunner glands. So Brunner glands are the mucus producing glands. Where? Mucus producing glands in the duodenum. Now my question to you, tell me, what are those glands which are producing mucus in the stomach? Who produces the mucus in the stomach? You know, mucus in the duodenum is produced by the Brunner glands. Also there are cells called as the goblet cells. Goblet cells also produce mucus in the intestinal region. That's fine. But who produces the mucus in the stomach? So these glands, the name of these glands are neck cells and foveolar cells. Foveolar cells, also called as the surface mucous cells. So, there are two types of cells. Okay, the one is the foveolar cell or the surface mucous cell. Second one is called as the neck cell. So, these two cells are present in the stomach and they produce the mucus in the stomach. What do they produce? They produce mucus. Usually students confuse and say mucus in the stomach is produced by the goblet cells. Never. Goblet cells are never seen in the stomach. Goblet cells are seen in the intestines. Okay. So, what are the mucus producing cells in the stomach? Foveolar cells and neck cells. Fine. Let us continue. Let us begin our topic with the saliva. Okay. When compared to our body fluids, saliva is hypotonic. Okay. Saliva is hypotonic. How much saliva is produced every day? Almost 1.5 liters of saliva produced every day. That much important, you already know it. Saliva is produced from which glands? Saliva is produced from the salivary gland, and what are those salivary glands which you know? Parotid glands, submandibular glands and sublingual glands. These are things which you know, but there are many salivary glands, guys. Okay, there are many minor salivary glands in the oropharyngeal region. Now, out of all, what is the major salivary gland? The major salivary gland is called the submandibular. Submandibular salivary gland. Okay, submandibular salivary gland is a major salivary gland and it produces almost 70% of the saliva, because it produces 70% of the saliva. Okay, and newly discovered salivary glands. Okay, recently a new set of salivary glands were discovered. They are called as the tubarial glands. Not much important for your exam, just know it. Next, saliva, it contains some enzymes. Why? For the digestion purpose. Which enzymes are present? Saliva contains salivary amylase. Okay, salivary amylase, also called as thiolin. Also called as what? Thiolin. Helps in the digestion of what? Carbs. Okay, helps in the digestion of carbohydrates. So, very important. In your saliva, in your mouth itself, the carbohydrate digestion begins. The sugar digestion begins. Okay. Next, any other amylase? There is something called as lingual lipase. Lingual lipase. Now, question, from where this lingual lipase is coming? This lingual lipase is produced from Ebner's gland. Okay, produced from where? Ebner's gland. Now, what exactly are these Ebner's gland? Ebner's glands, they are the minor salivary glands. I have told you. Okay, what you know is only 3 salivary glands. That's the parotid, sublingual, submandibular. But there are many other salivary glands, guys. Okay, minor salivary glands are there. These minor salivary glands are called as what? Ebner's gland. So, these Ebner's glands are the ones which produces the lingual lipase, and this lingual lipase helps in the digestion of what? Lipids. So, your saliva can digest. Your saliva can digest carbohydrates. Your saliva can digest lipid. But saliva cannot digest the proteins because there are no proteases. So, protein digesting enzymes are not present in the saliva. Okay, you should know that. Okay. So, no protein digestion or no enzyme for the protein digestion. You have all studied that in anatomy, every gland, okay, has a nerve supply. Okay, whenever the action potential comes and touches these glands, whenever this electricity comes and touches these glands, then the glands are going to secrete. Okay, secrete the secretions. Now, these salivary glands, from where they are getting the nerve supply? What is the nerve that is stimulating these glands? So, parotid salivary gland is innervated by which nerve? And sublingual and submandibular salivary gland are innervated by which nerve? Tell me, the salivation is sympathetic activity or parasympathetic activity? Definitely salivation is a parasympathetic activity, right? Mainly parasympathetic. Parasympathetic. So, definitely a parasympathetic nerves should be stimulating our salivary glands. So, what are the parasympathetic nerves? The parasympathetic nerves, everyone knows, 3, 7, 9, 10. These are the parasympathetic cranial nerves. So, out of all these parasympathetic cranial nerves, 3, 7, 9, 10, which cranial nerves are coming and stimulating our salivary glands? The answer is very simple, P. If you just flip the P, the P will become 9. So, that is the 9th cranial nerve. Okay, 9th cranial nerve. So, 9th cranial nerve, that is glossopharyngeal. Now, the glossopharyngeal nerve will stimulate the parotid salivary gland. Next, what about the sublingual and submandibular? Submandibular, something like starting with S. S for what? 7. So, out of 3, 7, 9, 10, who is starting with S? 7. So, the 7th cranial nerve, that is a facial nerve. Okay, 7th cranial nerve, that is a facial. Okay, facial nerve is going to stimulate the sublingual and submandibular salivary glands. So it's the 9th cranial nerve and the 7th cranial nerve. It's a glossopharyngeal nerve and the 7th cranial nerve stimulating our salivary glands to produce the saliva. After discussing this, anything else is present in our saliva? Any other substance is present? Yes. Saliva also contains certain important antibodies. Which antibodies? If you ask me, the antibodies are IgA antibodies. IgA antibodies are present. See, these IgA antibodies, they are present in all the secretions in our body. They are present in each and every secretion in our body. Not only the saliva, they are also present in the gastrointestinal secretions, urogenital secretions, okay, respiratory secretions, every secretion in our body. Okay, if they ask you what is the antibody that is present in our breast milk, okay, breast milk is also secretion, right? IgA antibodies. So IgA antibodies is not something special to the saliva. It's present in every secretion in the body, guys. Okay, so these IgA antibodies are called as, for your exams I am telling you, they are called as secretory. They are called as secretory antibodies. Okay, they are called as secretory antibodies, every secretion. Next, anything else is present in the saliva? Yes, some antibacterial substances are there like lactoferrin and lysozyme, which will kill the bacteria. Okay, these are the antibacterial substances like lactoferrin, lactozyme are present. Next, what else you should know regarding saliva? See, two important MCQs, direct single liners. If they ask you maximum potassium, okay, maximum potassium ions are secreted into which body fluids? Maximum potassium is secreted into which body fluids? The answer will be saliva. Saliva contains lot of potassium. But if they ask you maximum potassium, same potassium, concentration is present in, concentration wise, okay, concentration wise the maximum potassium is present in colon fluids, colon, the answer will be colon, okay, colonic secretions. So how to remember this? S for S, C for C, concentration CO, concentration for colon, secretion for saliva, okay, but simple, saliva contains maximum which ion if they ask you? Potassium, okay, maximum potassium is secreted into saliva, that should be your answer, okay, done. Next, let's see some more important points about the salivary glands. You can see here the baby where the cheeks are swollen, okay, the cheeks are swollen red. What is this condition called as mumps? You all know mumps. See, in mumps, who is going to be affected? It's the salivary glands that's getting affected. So this mumps, which is because of the mumps virus or the paramyxovirus, where this virus wants to grow, the mumps virus is growing in the salivary glands. So whenever the salivary glands are getting affected, especially the parotid salivary gland, okay, the parotid salivary gland is getting affected, leading to parotitis. So tell me, what is that condition in which the salivary glands are getting affected? Viral infection of the salivary glands, it's a mumps. But for your exam, you have to remember, mumps not only likes the salivary gland, but it also likes one more important structure, that's your reproductive organs. So testis. So in males, testis can be affected, in females, ovaries can be infected, okay. So inflammation of testis can lead to orchitis, inflammation of the ovaries can lead to oophorytis. So what I am trying to say, imagine there is a child who is suffering with the red swollen cheek, parotitis, and the child is also having this orchitis, inflammation of the testis. So you have to think about what is the infection? Mumps infection, okay. Next, what else you should know regarding the salivary gland? Guys, listen. There is an autoimmune condition, let me write here, autoimmune, destruction of, autoimmune destruction of salivary glands. So now tell me, when your salivary glands is getting damaged, autoimmune, your own immune system is coming and damaging the salivary glands. So what will happen whenever the salivary glands are getting damaged? So there is going to be xerostomia. Xerostomia means dry mouth, dry mouth. Now tell me, what is the name of this disease? Xerostomia, where you have studied. So this disease is called as Sjogren syndrome. Sjogren syndrome. Sjogren syndrome. So Sjogren syndrome is a rheumatic disease, or you can say autoimmune disease, where the salivary glands are getting affected. But in these people, to their bad luck, not only the salivary glands will be affected, but also lacrimal glands will be affected. Lacrimal glands. Lacrimal glands are also affected, so they can't produce the tears, so the eyes will be dry. There is zero ophthalmia. So now in your future exams, wherever you see xerostomia in combination with xerophthalmia, what is the name of the disease called as Sjogren syndrome? And why we are discussing about the Sjogren syndrome right now? Because in Sjogren syndrome, your salivary glands will be destroyed. There is autoimmune destruction of the salivary gland called as the Sjogren syndrome. Okay. So with this, what we have completed? We have completed the topic of the first secretions, that is the saliva. In the next video, we will be discussing about the gastric secretions. What are the different types of gastric secretions? Means the secretions that are happening in your stomach. Hope the video is helpful. Thank you.